It might be planned in advance, which we call an elective C-section, or it could be an unplanned decision made during labor to ensure everyone stays healthy. It's a very common and hello there, let's have a chat about something that many parents-to-be think about, the cesarean section, or C-section for short. It's simply a different way for your baby to be born, where a doctor helps deliver your little one through a small opening in your tummy and womb. While many babies are born through a vaginal delivery, sometimes a C-section is the safest option for both mum and baby. Procedure. So let's explore it together. There are several reasons why your doctor might recommend a C-section. Sometimes it's about the baby's position. If your little one is lying sideways or bottom first, breech, as we call it, and can't be turned, a C-section makes for a gentler birth. Another reason could be related to the placenta, that special organ that feeds your baby. If it's blocking the baby's way out, which is a condition called placenta previa, a C-section is necessary. For mums expecting more than one baby, like twins or triplets, a C-section can often be the safest route for delivery, making sure each baby arrives with the best possible care and attention from the medical team. Other times, the decision is based on the environment inside the womb. For instance, there's a condition called oligohydramnios. It's a big word, but it just means there's a lower than normal amount of amniotic fluid, the protective liquid that surrounds your baby. This fluid is important for your baby's development and movement. When the levels are low, it can sometimes be a sign that it's time for the baby to be born. Your doctors will monitor this carefully with scans, and if they feel it's what's best, they will discuss the option of a C-section with you to ensure a safe and sound delivery. Finally, ensuring your baby gets plenty of oxygen is the top priority for everyone. Sometimes, there can be concerns about the baby's oxygen supply, a situation known as fetal hypoxemia. This might happen for various reasons, perhaps if the umbilical cord gets squeezed or wrapped in a certain way. Doctors can spot potential signs of this during monitoring and ultrasound scans. If they believe your baby might not be getting all the oxygen they need, they will act quickly. Choosing to perform a C-section in this scenario is a proactive step to bring your baby into the world safely before any problems can arise. So, what happens when a C-section is planned? The preparation phase is all about making sure you are comfortable, safe, and fully informed. Before you go into the operating theatre, your medical team will have a good chat with you. They will explain exactly what will happen and answer any questions you might have. No question is too small. You'll be asked not to eat or drink for a few hours before the surgery, which is standard for any operation. A midwife will help you get ready, perhaps by giving you some special stockings to wear to help with circulation, and placing a small tube, called a cannula, in your hand for fluids and medications. Next, it's time for the anesthetic. For most C-sections, you will be awake for the birth of your baby. This is usually done with a spinal or epidural anesthetic. An anesthetist, a doctor specially trained in pain relief, will give you an injection in your lower back. It might feel a bit strange, but it works quickly to numb the lower half of your body, so you won't feel any pain during the surgery. You'll still be able to feel some gentle touch and pressure, but that's completely normal. This type of anesthetic is fantastic because it means you and your birth partner can be fully present for that magical moment when you meet your baby for the first time. Once the anesthetic has taken effect and you are comfortably numb, the team will make the final preparations. They will place a screen across your chest, so you don't have to see the surgery itself unless you want to. Your birth partner can usually sit right beside you, holding your hand and offering support. The team will also clean your tummy with an antiseptic solution to prevent any infection and place a small tube, called a catheter, into your bladder to keep it empty during the operation. This is all done with great care to ensure you are feeling secure and ready for the main event, the arrival of your little one. Throughout this entire process, the focus is on keeping you and your baby safe and calm. The operating theatre is a busy place, but everyone has a specific role. You'll have midwives, obstetricians, the surgeons, an anesthetist, and nurses all working together for you. They will be constantly checking your blood pressure, heart rate, and oxygen levels to make sure you are doing well. It's a real team effort, and you are the most important person in the room. Remember, They do this every day, and their expertise is there to give you peace of mind as you prepare to say hello to your new family member. Now for the part you've been waiting for. The surgery itself is usually very quick. The surgeon will begin by making a small, neat incision on your lower abdomen, just above your bikini line. This type of cut is often called a Pfannenstiel's incision, and it's popular because it heals well and the scar is usually hidden. The surgeon will then carefully make another opening through the layers of tissue and muscle until they reach your womb. There are different techniques for doing this, and one modern gentle method is called the Misgav-Ladak Cesarean section, which aims to minimize tissue damage and help you recover faster. You won't feel any pain, but you might feel some pulling or pressure as the doctors work. This is perfectly normal. The most exciting moment happens next. The surgeon will gently lift your baby out from your womb. This part usually takes just a few minutes from the start of the surgery. You and your partner might hear the doctor say, "Here comes your baby." And then, you'll hear that very first cry. It's an incredibly emotional and wonderful moment. The midwife will be right there, ready to check on your baby, dry them off, and make sure they are breathing well. Once your baby is born, the team's focus splits. While one team looks after you, another is dedicated entirely to your baby. The umbilical cord will be clamped and cut, and if your partner wishes, they may be able to do this. The midwife will give your baby a quick health check and wrap them in warm towels. As soon as everything is confirmed to be okay, your baby will be brought straight over to you for that all-important skin-to-skin contact. Cuddling your baby against your chest helps regulate their temperature and breathing, and it's a beautiful way for you to start bonding right away. While you are having your first cuddles, the surgeons will be finishing the operation. They will deliver the placenta, and then begin carefully closing the incisions in your womb and abdomen with stitches. These stitches are often dissolvable, meaning they will disappear on their own over time. The whole procedure, from the first cut to the last stitch, typically takes around 40 to 50 minutes. All the while, the anesthetist is by your side, monitoring you and making sure you are comfortable. Before you know it, you'll be on your way to the recovery room with your beautiful new baby in your arms. Once the surgery is complete, you and your new baby, along with your birth partner, will be moved to a recovery area. Here, a midwife will keep a close eye on you for the first few hours. They will check your blood pressure, feel your tummy to make sure your womb is contracting back down, and check your wound dressing. The numbness from the anesthetic will slowly start to wear off, so they will make sure you have good pain relief ready to keep you comfortable. This is a lovely, quiet time to focus on your baby, continue with skin-to-skin contact, and perhaps try your first feed if you feel up to it. Over the next few days in the hospital, your recovery will be the main focus. The midwives will encourage you to get up and move around as soon as you feel able. It might seem daunting at first, but taking a short, gentle walk helps prevent blood clots and gets your body on the road to recovery. They will help you with everything you need, from going to the bathroom to showing you comfortable positions for feeding and holding your baby that don't put pressure on your wound. The catheter will be removed, and you'll be able to eat and drink normally again. Don't be afraid to ask for pain relief whenever you need it. Going home after a C-section is a big step. Most mums stay in the hospital for 2 to 4 days. Before you leave, your doctor and midwife will make sure you are recovering well and feel confident about looking after yourself and your baby at home. They will give you plenty of advice on wound care, pain management, and what activities to avoid. For the first 6 weeks, you'll need to take it easy. No heavy lifting, anything heavier than your baby, no strenuous exercise, and no driving until you feel comfortable making an emergency stop and your insurance company gives you the all clear. Remember, recovering from a C-section is a journey, not a race. You have just had major surgery as well as a new baby. Be kind to yourself and accept all the help you can get from family and friends. Your body has done something truly amazing, and it needs time to heal properly. Your community midwife will visit you at home to check on you and your baby, answer your questions, and support you as you settle into your new life together. Every day, you will feel a little bit stronger, and soon you'll be back on your feet, enjoying every moment with your little one.